Hi everyone, I think all of you are pink of health. Today my topic of discussion is brachial plexus and its clinical anatomy. Now before describing the brachial plexus, I will show you certain point. When two vertebrae they unite, then there is a gap between the inferior vertebral notch of the pedicle and the superior vertebral notch of the vertebra below, and this is known as the intervertebral foramen. Now you see, this is the magnified view of the vertebra, on which in the vertebral canal you will see the number of nerve fibers that constitute the spinal cord. From the spinal cord, from the each segment through the intervertebral foramen, that is coming out of the segmental nerve, which is divided to two. One is ventral rami, another is the dorsal rami. So you will see in this also the lumbar plexus, you will see through the ventral foramen, you will see there is coming out of the nerve. Now I shall discuss about the brachial plexus. This is the real skeleton of the cervical vertebra with the occipital bone attached to it. Now from the C5 there is attachment of C5, C6, C7 and C8 and T1 nerve, which constitutes to forms the brachial plexus. Because you know the brachial plexus supplies all the muscle, the cutaneous supply, the joint supply is by this brachial plexus of the upper limb, and this upper limb comes out as a paddle-like marks on the paraxial mesoderm from the region of the neck and the thorax. So that's why brachial plexus supplies the upper limb. Now you see the two roots, that means C5, C6, they unite, and you see this blue color I have in, this is from the upper trunk, and this root and the upper trunk you will get it in the this part, that is the posterior triangle of the clavicle. Now you will see it has got, so it is the upper trunk, the C7 it forms the middle trunk, and the T1 you see T1 and the C8 it forms the lower trunk of the brachial plexus. This trunk and root all lies in this region, that is the posterior triangle of the neck. Then there is division of this trunk. The trunk divide into anterior division, all are divided into anterior division, which is represented here the red color, and you see there is the posterior division, you see it will represent here as an yellow color. So this is the posterior division of this trunk. Now you see this upper two division, this one, these two division they unite and form the lateral cord of the brachial plexus. You will see, which you have seen in the dissection, and also you will see in the book the picture. So this is the how the lateral cord is formed, and the medial cord is nothing but the continuation of this root, that means the lower trunk. So this is how the lateral cord and the medial cord is formed. Now the union of this yellow color, that is known as the posterior cord of the brachial plexus. Now this whole of the posterior division they unite and ultimately forms the posterior cord. What is the, how this nomenclature is formed? Why you will get this nomenclature? This nomenclature is formed by the axillary artery. You see from here from the outer border of the first rib, the axillary artery descend. So medial to the axillary artery, this is the medial cord. Lateral to the axillary artery, this is the lateral cord, and this is the posterior cord of brachial plexus. Now the brachial plexus gives so many of branches, some branches coming out from the root, some branches coming out from the trunk. Now in this upper trunk there is junction of the 6 nerve. This is the 2 root, the trunk, and one is nerve to the subclavius, another is the suprascapular nerve. So this region is known as Erb's point. It is very important because due to strenuous delivery or complicated delivery, this region becomes affected and the baby is born, side hand is twisted towards the externally. That means the external rotation of the palm. Now this may be corrected within 1.5 months if somebody is lucky and actually localize this disease. But if somebody not care about the disease, this persists throughout the whole life. Next is we will see the lateral cord. From the lateral cord arises the branches that supplies in the region of the arm. It pierces the coracobrachialis, it supplies the biceps brachii, that is the strong flexion muscle of the elbow joint, you will see, and also the brachialis muscle. Now from the medial cord you will see there is presence of ulnar nerve and 2 cutaneous nerve, one is for the forearm and one is for the arm. So this ulnar nerve is very important, and one can feel the ulnar nerve is actually back of the medial condyle here. One can feel. So this ulnar nerve is very important for the clinically, because somebody is fall down with outstretched hand, this ulnar nerve is injured. So there may be the paralysis of this nerve. Now the posterior cord, you will see the posterior cord. From the posterior cord there are many branches, but the most important terminal branch is axillary nerve, which supplies the deltoid, and another is the radial nerve, which supplies actually the arm muscles, that means the triceps, the extensor of the forearm, as well as cutaneous supply of the medial 3/4 of the arm, palm. So this is the brachial plexus. So this is very important not only for the injury, but if somebody want to do the operation on the upper limb, you need not go to the spinal anesthesia or you need not go to the general anesthesia. You just block the brachial plexus where it comes at the region of the axilla, and it lies within the axillary sheath along with the axillary artery and the vein. So how you will give this anesthesia? You will fully abduct the arm and you will feel near the head of the humerus, you will feel the artery, and then you will push the anesthetic agent. Or it is difficult for somebody, then one can go to the supraclavicular route. So in this way the brachial plexus is very important. And another paralysis may go, that is the lower trunk paralysis, and that is known as Clumsy paralysis. This lower trunk paralysis is actually occur during the delivery of the baby, and it requires 3 months time to recover because small muscles of the hand is partially inactive at that time. So this is the brachial plexus, and I will show you another picture of the brachial plexus. You will see how it comes from the neck region into the axilla. So this finishes the brachial plexus. Thank you everyone.